How did Civil War soldiers treat their wounds in the field? Have you ever wondered how soldiers managed to treat their wounds during the American Civil War? The reality was that it was a tough and often chaotic situation. Medical resources were limited, and knowledge about treating injuries was still developing. The main goal was to stabilize the soldier and prevent further injury until they could get more comprehensive care. When a soldier was injured, the first thing medical personnel did was apply a tourniquet. This was crucial to stop the bleeding and prevent excessive blood loss, which could lead to shock or even death. Once the bleeding was controlled, the next step was to assess the injury. Medical staff would determine if there were broken bones or if the wound was caused by a bullet or shrapnel. If a bullet or foreign object was lodged in the wound, it needed to be removed. This was done using specialized tools like bullet forceps. Unfortunately, this process was often painful and typically performed without anesthesia due to the urgency of the situation. After removing any foreign objects, the wound would be cleaned and dressed. However, the understanding of infection was limited at the time, leading to high rates of infection and mortality. Anesthesia was used in most surgical procedures, including amputations, but it was not always available for initial treatments in the field. Chloroform and ether were the most common anesthetics, but the chaotic conditions of battle often meant that soldiers had to endure treatment without them. Amputations were a frequent surgical procedure during the Civil War. They were often necessary to save lives by removing damaged limbs that could become infected. These amputations were classified into 3 categories: primary, intermediary, and secondary. Primary amputations, performed within 48 hours of injury, had the highest survival rate. The way wounds were treated in the field had practical implications for infantry tactics. Soldiers faced dangerous conditions, and the ability to quickly treat wounds could impact military operations. The establishment of field hospitals and organized medical teams improved the efficiency of wound treatment. This allowed soldiers to receive care more quickly, increasing their chances of returning to duty. In terms of infantry equipment, having medical supplies and tools was essential. Soldiers carried basic first aid kits, but more complex treatments required specialized equipment and trained personnel, which were often scarce on the battlefield. The limitations in medical care influenced how commanders planned battles and managed casualties. Rapid evacuation and medical support became vital components of military strategies during the Civil War.